Okay, we're on, Shelly. So I am here today with Shelly Azevedo, and she's a dental hygienist and myofunctional therapist. And before I get into more about your story, let's just kind of talk about what we're doing here. So today is May 20th, which means we're 20 days in to my mouth breathing awareness campaign. And I started this campaign to bring awareness to myofunctional symptoms, mouth breathing, of course, being one of those. But mouth breathing is like a red flag for so many other bigger issues that I feel like it's something that we can all hone in on as dental professionals, even as parents, and it's something that you can notice in yourself as well. So I feel like it's a really good thing to just start noticing and paying attention to. But I'm asking all of my amazing MyoMentor graduates who are dentists and hygienists to share their stories on their experiences, either personally with mouth breathing and myofunctional issues, or their family stories, or people they care about. So Shelly's here today to share her personal story. And I know we were talking before, Shelly, and you're saying, well, I can trace this back all the way to when I was a baby. So I think that's where I want to have you start. But before you go into your story, just talk a little bit about how you got into myofunctional therapy and kind of your story as a hygienist and stuff too.
Well, I got into myofunctional therapy. Actually, I was in clinical private practice full time for, gosh, close to 15, 20 years. And then I started teaching dental hygiene. And it was through an introduction course with Joy Moeller from the Los Angeles area. And as I was watching her presentation on myofunctional therapy, I was looking at the case presentations and I'm thinking, that's me, that's me. That's my son, that's my daughter, that's, the patients that we didn't have answers for, that had oral health issues, dental issues, that we really didn't know how to resolve those issues for those patients. So that was my first glimpse into the myofunctional therapy world.
Yeah,
And I was
when you have that personal connection, I think it was Dr. Maggie Graham on her interview. She said, you get passionate about it once you realize that it's you or your family, right? So
yeah,
it's like
yeah,
your
you
first
do.
step
And
in.
so I wanted to learn more, and hygienists are kind of like that. We're lifelong learners. So yeah, that got me on to wanting to take more courses. And I don't think I actually took another course until about 2 years later. I was pretty involved with teaching at the time.
Mhm.
But I started taking courses, a lot of courses, because it was just fascinating. I was just so hungry for information on this, on how to, how to help myself, because I was having a lot of these symptoms.
Totally.
And in one of the courses, I met Dr. Zaghi. So, he's
Our
like, oh my
hero.
gosh, it's Dr. Zaghi. And he was so kind and gracious. I asked him, I said, I think I have a tongue tie. And he goes, well, open your mouth. And right there he was going, yep, you do. And so, one thing led to another. And I had a tongue tie release by Dr. Zaghi, and Sonda was there, and she was just amazing.
Yeah.
Going through that experience. And
Yeah.
it definitely did help with some of the symptoms that I was having. And I also felt too, like, if I'm going to go into this profession, I'm going to go in full speed
Yeah.
ahead and figure it out on myself first.
Totally.
So I did the myofunctional therapy, and then I found your course, which I really enjoyed, and the support and the camaraderie that's within the MyoMentor group is just amazing. And learning, from each other, and learning to put these collaborative teams together.
Yeah.
So that's really, it's been just such an interesting, fascinating, positive journey in the myofunctional therapy world. So I did myofunctional therapy on myself.
Yeah.
And
Now, this is where I know your story, you wanted to go back to when you were a baby. So do you want to go back and like you've kind of delved into your past dealing with these things in the present, right? So what
right,
did you
right.
notice? Like you told me this whole progression of everything through your life. So I think you should go back and start when you were a baby and what you learned from your mom and stuff like that.
Yeah, so again, in taking coursework, learning more about birth history, I was the colicky baby. My poor mom, I was first born, and she had a colicky baby up until I think I was about 2 years old.
Oh, wow.
Um, just, I feel for my mom, and thinking about this little baby that couldn't swallow, and nobody knew why they were so fussy all the time. So, digestive issues. And we now know that I had a lip tie. I not only had a tongue tie underneath my tongue, but I had the lip tie up here.
It was a pretty tight one, right?
Yeah, it was very tight. And I just had that released about 8 months ago,
Wow.
just because I was curious to see if it would help with some of the neck and pain patterns that I have. So yeah, I was a colicky baby. I sucked my thumb, and I had a really nice overbite. So I was headed to the orthodontist, and they put me in headgear. So
Okay,
it
yeah.
was, the traditional retractive headgear. So as I'm growing and developing, between the braces and the thumb sucking and all these compensations, it's affecting the way that my face and jaw are growing.
For sure.
And my tongue is not functioning correctly. So
And you talked
fast,
about your tonsils and adenoids too at that time.
yes.
You don't remember mouth breathing though, do you? Really? You just know that.
No, and I went back and I looked through pictures, and the
Mhm.
pictures I was smiling, right? So it's kind of
Yeah.
hard to picture, it's like, oh, was it mouth breathing? I must have been mouth breathing because I had chronic tonsil issues. So I was probably mouth breathing at night.
Yeah.
So yeah, kind of going back and
Did you have them taken out or removed?
yeah,
I mean, yeah.
yeah, they
How
were
old were
removed.
you?
I was 6 when that happened.
6. Yeah. So I mean, that's the age. I mean, probably meaning all leading up to 6 years old, you were having breathing or allergy or who knows. It could have been any type of symptom leading to that inflammation. Or actually, what we're finding too is that sometimes just a tongue tie leads to mouth breathing, and then
Mhm.
the mouth breathing is what causes the large tonsils and adenoids, right?
Yeah, yeah, I know. It's a cycle. It's
Yeah,
crazy to go back and to look at this stuff from a different, myofunctional lens, and the impact that breathing has on how we grow and develop.
for sure. So then you have braces, tonsils taken out. Then what was kind of the next step or phase?
I was really pretty good. I do look back. I had a lot of test anxiety, and
Hmm.
I kind of wonder if maybe part of this played into the mouth breathing, and when we don't breathe correctly, we overbreathe, and it affects our nervous system.
Yeah, you're in more fight flight mode.
Yeah, yeah. And so anyway, everything was usually was pretty good up until late 20s, early 30s, when I started having a family. And the clenching and the grinding came into play. So I was
Mm,
grinding, thinking, oh, it's just stress. The
yeah.
doctors that I worked for, you need a night guard, and not really sleeping great, but then also having young children and
And
thinking, oh, it's just,
yeah, and
being a
as a
mom.
hygienist, you're kind of hunched over anyway, so you think, oh, all this neck and shoulder pain, it's all just part of the job. And so is that you were clenching and grinding? Is that when you started getting more pain as well at that time?
Yes, the pain was really manifested into chronic migraine.
Wow.
And again, not thinking so much about stress and clenching, but I really can kind of trace it back to, I think I really started mouth breathing with wearing a mask and getting started into dental hygiene.
Interesting.
Yeah, so, and I find now that in COVID, putting a mask back on, I start to find myself wanting to breathe through my mouth. And now that I'm more aware, it's like, okay, breathe through your nose,
Whoa.
breathe through your nose. But I do think that if you take anybody and you put a mask on their face and you put a forward head position, as in the dental world, we are working over our patients in a forward head position. Our diaphragm, we're not really able to practice proper breathing because our diaphragm is like a sponge, and when we hunch over, that becomes compressed. So
Compressed, yeah.
our breathing patterns change,
Oh my
and over
gosh.
time, it becomes the new norm.
You're the first person I've ever heard talk about the reasons. I mean, I feel like I used to mouth breathe more when I had a mask on as well, but I didn't think about the forward head posture, the compressed diaphragm. Also, there's a little bit of like increased CO2, which makes you want to mouth breathe more. So it's That's super interesting. So I think all of us who wear masks have to be like really aware of the potential for now reverting to mouth breathing while you wear the mask, which is unhealthy. So
Mhm.
that's such a good point. I love that you brought that up.
Yeah, yeah. I'm putting out in social media posts on my website, trying to get people to, you know, be aware, use your nose when you're breathing in your mask, and
Yes.
trying to get that information out there just to kind of help raise awareness
Well,
too.
and those the N95 masks that people are having to wear are so hard to breathe through in general that I've heard a lot of people feel like they have to mouth breathe with those on. So that's man, what a bad, and then you're mouth breathing, and so that now your body isn't cleaning and filtering any air that or aerosols that could potentially get to you. So bad, bad
Yeah,
cycle.
yeah.
All right, so then what happened next? So you were getting pain and stuff, clenching, grinding, night guards made. Did you start to have sleep issues at that point,
Oh
or?
yeah, I was having, just waking up a couple times a night, so all signs of poor quality sleep, and basically this went on, I kind of traced it back, I'm guessing 25 years, of
Wow.
dealing with this.
And
And
at the time, if somebody asked you if you slept badly or that you were, had like sleep issues, you probably would have said no, huh?
yeah, I'm just a mom.
Yeah, yeah.
I work full time and I've got two children
You're
and
stressed.
stressed, and this is just life. You're in life. You're
Yeah,
not thinking beyond that.
yeah.
Um,
So common.
so I had a wake up call in 2008. I had transitioned from clinical dental hygiene to I was now working I was working in dental hygiene education, and I had been there for about a year, loving it. I just loved, the teaching, and that was so much fun for me. But I had a breast cancer diagnosis,
Oh, wow.
and when you get that diagnosis, you wonder what could I have done? What caused this?
Hmm.
And
Hmm.
again, just on this journey of learning about mouth breathing and myofunctional therapy and all the courses that I'm taking, I couldn't help but wonder if the mouth breathing actually changes the pH balance of your blood, and you are in a more acidic state. And if you're
Definitely.
in an acidic state, it's chronic inflammation. And has my body been dealing with this for 25 years? And is this
Yeah.
something that could have contributed? I
Well,
don't know.
it's not just that. It's, if you're not getting into those deeper levels of sleep, you said you felt like you had bad sleep
Yes.
for 25 years, it's getting into that stage 4, stage 3 REM sleep. That's when your body is recovering and repairing and regenerating. And so on top of it, the breathing stuff and the pH changes, if your body's not getting into that restorative, reparative state, then gosh, I mean, think about the big impact of that. I think you're so smart, Shelly.
Well, I don't know. It's none of it's evidence-based, backed up, but
No, I love
you,
how you're so curious. Your mind is like thinking about all these connections. It's
you
great.
can't help but wonder. And
Yeah.
it's like now that I am an empty nester and I do have time to work on my health, it's like my goal is I want to have a quality life. I don't want to be taking pills. I don't want to be
Yeah.
I want to do everything I can to keep my body healthy. And what is interesting about the sleep, Sarah, that you bring up is that I've had 2 sleep studies, and doesn't register.
Yeah.
I don't have sleep apnea. And I think
That's
it's the upper airway resistance
for
syndrome.
sure. That's the big problem, is that we can't use the typical sleep study as a way of diagnosing UARS. It just doesn't, it flies under the radar because it's more of a sympathetic tone issue. Like your body is preemptively sending these arousal signals to, wake you up, although you don't fully wake up, but it's before there's any sort of apnea or hypopnea. It's like your body's in this high alert that you're going to stop breathing, so it wakes you before you even get to that point. And so it won't register on a sleep study.
Yeah.
And that, I wish more people understood that, because you can't, if you just go get a regular sleep study in a lab, which is like sophisticated and high tech and everything, a lot of times it won't pick up on people who are in that type of range.
Yeah.
So
And that's been frustrating,
yeah.
and
Have you tried the watch pat, the one where you get the little thing on your finger?
I haven't done that yet. And that's something I'm thinking about
Dr.
pursuing.
Zaki has those. You can get in touch.
Yeah, no, that's on my list.
Yeah, I think that's probably when you're trying to get just a screening for UARS, I think that's a really good tool. So anyway.
Yeah.
Well, let's go back to your story. Sorry, I'm sidetracking you. So
Oh no, that's okay.
you got the breast cancer diagnosis, and then what happened after that? And obviously you seem to have recovered. You're here. You're
Yeah, no,
now.
I think, yeah, so, some of the other things that I incorporated into my sleep hygiene is taping at night. So
Mm-hmm.
my husband laughs at me. I
Yeah.
have my nasal strips, my breathe right strips on my nose, and I have my mouth tape, and
Good. That's got to do it.
working on sleep. And again, Dr. Zagi's got some great tips on sleep hygiene, and trying to really, work on the sleep component of what's going on with me.
Mm-hmm.
And continuing to try to work on myofunctional therapy on myself, strengthening and toning my tongue.
When you got your tongue tie released, like not too long ago, like 2-3 years ago?
Well, I had the lingual tie. I had that released probably 5 years ago. Dr. Zagi he'd probably been doing them for about a year.
Yeah. Okay.
The lip
Did you
tie I had
notice,
released about 8 months ago.
after the tongue tie release, did you notice changes? Did you notice like your tension, your pain, anything like that? Did anything improve for you?
What I noticed was the webbing in my neck. See, this is the reason that the tongue ties were never diagnosed, was because of the neck compensations and I think the jaw compensations. So the floor of my mouth was lifting. And yeah, I've got one little spot over here that sometimes the webbing, it'll kind of, I see it and it's like, stop.
Yeah, those muscles are.
But I
active.
had more, you could see the tension when I talked or when I opened my mouth, you could see the webbing in the neck. And that definitely calmed down. It was interesting to see that.
Yeah.
Yeah. So there was improvement. The other thing I didn't have access to, I think bodywork is really important when you're dealing with the tongue tie releases. And at the time and where I lived, I didn't really have access to somebody who could get in and work on the fascial restrictions and release the fascia that had been involved in this tongue tie. So
have you done that since?
May have been better.
Yeah.
That I had
have you
that.
been doing that lately?
Yes, actually I have. That's been a whole other journey.
Yes, I know. But you're right. I mean, especially people who are in some degree of pain, and especially chronic pain, I think with the tongue tie release, you've got to do the body work too, that fascia work. It's like, it's so much more beneficial if you can. Obviously, not everyone has the resources or ability or finances, but if you can, I think it's more ideal.
Yeah, definitely. Yeah. So, I have 2 chiropractors I'm working with, and then there's another, it's called Bowen therapy, and they are addressing the fascial restrictions. And what's really interesting with the 2 chiropractors that I'm working with, some of the red flags that were consistently coming up with me was that my atlas was out, and your atlas, that C1 and C2, that correlates to the jaw. So there is a direct correlation between the two. So when C1 and C2 are out, that affects the joint, and it also affects the stability of your pelvis.
Yes.
And that was another thing.
Natalie
my
was
pelvis
talking
was
about
always
that.
out of rotation. So it's like tick, tick, tick. It's like,
yes.
Oh my gosh, how does this all align? And it's crazy.
I know, that's what Natalie was saying in her interview when she was talking about her pain and I think that atlas and the pelvis being connected. I was like, whoa, that's amazing. And it makes sense when you think about it.
Yeah. So I feel fortunate that my husband is so supportive. Tom, I know I'm high maintenance, but I also feel too, like when I'm working with my patients, patients come to me and it's like, we need to peel back the layers of an onion to figure out what is going on, because the mouth breathing, a tongue thrust issue, a tongue tie, there's more to it than it's not a quick fix. And so we need to find our team. And
definitely.
that's how I tell my husband, it's like, well, I need to find my team, so I'm going to go try this person and this person.
Yeah.
And I'm finding great resources up here in the Northern California area to
Good.
help patients with the different complex needs.
Good. Well, I think it's such, I mean, these stories, as like frustrating as it can be that you've had, you know, issues for your whole life and now you're just able to kind of get to the root cause of them. These stories, when you talk to your patients, you know, when you explain, like, I get it, I've been there, I've had to find, you know, deal with the same stuff. I think it really helps people understand. So again, that's why I want to share these stories, because I've found that when I share my story with my patients, that's what really connects so many dots for people. So I'm sure you're doing that with your patients too.
Oh yeah, yeah, you know, and I think too, just getting the word out, you know, and just trying to get dental professionals to, you know, just taking this full circle. My hope is that, you know, dental hygienists that may see this, or anybody that sees this, that if you can catch your kids when they're early, when early intervention, so that you don't end up with all of these issues as you get older, because this didn't really come full blown where I was seeing symptoms until I was in my 30s.
Yeah.
And there's so much we know we can do now from the dental community perspective to educate our families and our parents on just identifying children with mouth breathing. You know, let's look at that in the dental office.
I totally agree.
You know, and even as parents, if parents are looking at this, and to be able to take this information and go to your dentist and say, hey, you know, we saw this thing on mouth breathing, and what do you think about that? You know, this is how we get those conversations started.
I agree. Yeah, I think I'm hoping there'll be a big ripple effect, and it will help patients. It will help all of us healthcare providers be able to offer some of these things to our patients that we just maybe didn't know about before. And then I hope it will overall help the field grow and become more mainstream and more recognized by, you know, insurance companies and, you know, bigger organizations as like a real problem, you know? So.
Mm-hmm. Yeah, definitely.
Well, is there anything else you want to wrap up about your story? Is your sleep better now? Like, where are you today? Do you feel like a lot of the stuff has been resolved, or are you still working on a lot?
I'm still working on it. I'm kind of on the fence between looking at a mandibular advancement device to help with my sleep, which would bring my jaw forward.
Yeah.
And then the other would be palatal expansion. So going in and having the palate expanded so there's more room for my tongue to rest on the roof of my mouth and help
I
with
know.
the sleep.
It's all the
trying to figure that part out.
Yeah, we're all trying to figure it out too, me as well. So, well, thank you, Shelly. This has been really great. I think your story it's amazing how you can track stuff from so early and relate it all the way up till today. Let's talk about your practice, because I know you're seeing patients both in person, probably after COVID, and also online. So your myofunctional therapy practice is called Balanced Faces, right?
Correct, yes.
Yeah, okay. And you're in Roseville, California, which is in the Sacramento area. So if anyone's looking for a myofunctional therapist, I really hope they find you.
Oh, thank you. And there's a good group of us up here that, you know, that's been great. I moved about a year ago into this community, and a lot of forward thinking, outside of the box practitioners up here that it's just been a joy to work with. So.
All right, amazing. Well, thank you again for being here and for being willing to share your story. I'm just going to let you get on with your day, and I'll talk with you later.
Okay, thank you, Sarah.
You're welcome. All right.
Okay,
bye.
bye-bye.